And the next session is actually the first day it's a retrospective, and the second day will be a prospective. So the next session, as you can read, is a retrospective of the One Health EJP, from the idea to the realization. Karin, Ludo, thank you very much.
Thank you. So then I want to welcome you to this first panel discussion called Co-Construction with Stakeholders of an Ambitious Program, from the definition of scientific priorities to implementation and follow-up of the work carried out. And I will moderate this session together with Ludo, and I am Karin Artursson, working as the Scientific Director at the National Veterinary Institute in Uppsala, Sweden. And you hear me better now. And I have also been the leader of the work package 4 in the EJP, and we have been arranging different joint integrative activities, and we have also monitored the joint integrative projects. But I hand over to Ludo to moderate the first part of this session. Please.
Okay. Good afternoon. So, I'll have a sit. My name is Ludovico Sepe. I work in the Work Package 5 Science to Policy translation of the One Health EJP. All right. Oh, I really need to put it. All right. And so in this session here, we would like to, first we would like to have a look at how really we constructed the program together with the stakeholders. So first we'll have a look at the stakeholders' point of view, what were their needs, how those needs were communicated, and also how they evolved in time. And then we will move to the point of view of the One Health EJP, so how we address those needs really. And I'll moderate the first part, so the point of view of the stakeholders, and then I'll give the chair again to Karin, who will moderate the second part, so the point of view of the One Health EJP. And then we'll move to a short Q&A session. So the clock is already ticking, so I'd like to invite on stage our first panelist. So I'll call the panelists one by one as the discussion goes by. Our first panelist is Yvonne de Nas. Yvonne, if you would like to join us on stage. Yvonne works at the Dutch Ministry of Health, Welfare and Sports, where she's a senior policy advisor on zoonosis in the infectious diseases and zoonosis unit. There works both for the public health department and the pandemic preparedness department, and she's a program owner on behalf of the Dutch Ministry of Health for the One Health EJP. Welcome, Yvonne. So, as a it's good. National stakeholders, really. The national stakeholder played really an important role in defining the priorities, the scientific priorities of both the goals of the One Health EJP, both the scientific goals. Could you tell us something about which were the One Health priorities of the Netherlands, and what was the benefit for the One Health, which was the benefit to be on board of the One Health EJP? How the One Health EJP tackled these priorities?
In the Netherlands, we already were cooperating together in a zoonosis structure, which is an integrated human and veterinary risk analysis.
Could you leave it a little bit?
Oh, closer.
Yeah,
okay.
You need to.
Cooperation. And it involves the ministries and the institutes and other stakeholders. And the zoonosis structure started in 2011, and by the time the EJP One Health started, the focus of collaborating between the institutes was mainly on early warning and detection and making risk analysis. And the EJP One Health made it possible to broaden the collaboration between the institutes and align the research agenda and on scientific level and build better partnerships and also trust, because sometimes the interests of the institutes could be different. So getting to know each other and the trust and the research doing together. That was the progress we needed by the time the EJP started. And how it evolved in time? I think from our point of view, we find our zoonosis structure working quite adequately and effectively, and we see that one of the projects which Kitty was involved in is building a toolkit for other countries how you can share and assess the signals. As I said, we have good experience with that in minor and major crises, like mink with coronavirus. And as zoonoses are a cross-border threat, we think it would be a good thing to share our knowledge and our experience. So that's the involvement we're trying to to spread. Yeah.
Thank you. May I ask you, how were these needs that need cross-sectoral collaboration identified in the Netherlands? Is there normally an exchange across the ministries, or maybe between the agencies?
Well, we have informal meetings every month, but there's also that's on zoonosis from a broader perspective, but there's also for the EJP One Health a mirror group, and that was the group which we used to discuss the priorities that they were working on.
Okay,
so we organized ourselves for the EJP, but we already knew each other. So that's also one of the things. If you build a structure or a collaboration in peacetime, that's by the time you really need it, it's much easier to cooperate.
Okay, so really a good example of how to work across the sectors. But yes, the One Health EJP also wanted to collaborate across the borders. So in order to discuss a little bit about that, I would like to welcome on stage our next panelist. Stef Bronzwaer from EFSA, if you would like to join us on stage, Stef, and Ole Heuer, who's joining us online from ECDC. Stef is a medical doctor who serves as a research coordination at the European Food Safety Authority, EFSA, of course, in Parma. And his domain of expertise include One Health, communicable diseases, antimicrobial resistance surveillance, and food safety. And Ole leads the section on epidemic-prone diseases at ECDC. And his domain of expertise include management and coordination, prevention and control of communicable diseases, surveillance, antimicrobial resistance, zoonotic pathogens, and One Health. So, Stef, Ole, welcome. I'd like to pose the same questions to both of you to see the point of view of your different agencies. When it comes to ECDC and EFSA, which we call our key EU stakeholders, you were very much involved in the second call of projects, in identifying the scientific needs, the scientific priorities, to the point that certain topics were really directly communicated by ECDC and EFSA. Could you share with us how these topics that need cross-sectoral collaboration were identified or are identified in your respective agencies? Maybe I will start with Stef here on stage.
Yes. Good afternoon. You can hear me. Hello. Stef Bronzwaer, my name. Thanks for the invitation, first of all, to have the European Food Safety Authority not only here for the final meeting, but on the journey with you in the past 5 years. Indeed, we joined just a few months after the beginning, basically on your request to come forward with research needs from our side, which is not so straightforward, in fact, because we are an institute doing risk assessment. So we look at knowledge and we find knowledge gaps, but not always did we formulate from those knowledge gaps what are the research needs. So that coincided actually with the first RARA, as we called it, the Risk Assessment Research Assembly, where we started to, in EFSA, look more systematically at what our knowledge gaps are to try to formulate research needs. So that was a nice coincidence, actually, that your request came to formulate from a more global perspective, a One Health perspective, what these research needs are. So we brought together the different colleagues from the different units. At that time, actually, they were still a bit more scattered than today. In the meantime, actually, the different units working on biological hazards and animal health have come together. And they formulated in the requested time to the number of requests. You mentioned, I think, salmonella, for example. We've been working very actively. The Commission, the European Community, has worked very actively in the past years to bring down salmonella prevalence with success. And still, obviously, there were a lot of knowledge gaps around that. So that was one of the priorities that was communicated. And we did so, obviously, also in close liaison with the European Commission, who is typically requesting us as EFSA on the work to be done. So it was a good exercise to bring together the different people in-house. And actually, from that first meeting, we also agreed to establish liaison officers, as we call them, kind of a network of people, colleagues from the different units, to follow a number of the projects that later materialized and to remain in contact. So I think you made already there a push for EFSA also to become more transdisciplinary.
All right, thank you. Ole, when it comes to the ECDC, how did it work? How were these priority topics identified, and how they are identified right now at ECDC?
Thank you, and thank you for having ECDC in the final meeting as well, and having us on the journey as Stef expressed it. Being an EU agency, of course, the main priorities of ECDC are set by the Commission, and most recent examples of that are the enforced mandate, or the strengthened mandate, and also the cross-border health threat regulation. At the time when this request came from the One Health EJP, I think there was not much like structured One Health approach happening at ECDC. We have, and did also at that time, have a lot of collaboration, which we today would classify as One Health collaborations, especially with EFSA, also with EMA. And that today, we have, I think, identified more than 70 different areas where we are either doing regular outputs that has to do with One Health and or actually One Health activities. But back then, when your request came, I mean, there was not much thinking, and I think there was also several other big projects ongoing. So my impression is I was not involved myself from the beginning, but my impression is that EFSA was a bit more successful in making an effort to have an imprint on your work. The research agenda. Or such we can say the One Health research agenda for ECDC does not exist yet. We have only embarked actually on the whole One Health topic as of 2020. And as you may recall, just in January 2020, all priorities changed because of the pandemic, and we actually had to abandon the whole One Health thinking. Ironically, because you could say that the origin of the COVID-19 pandemic actually has very much with One Health to do as such. So it was a pity, but now we are trying to return to the topic in collaboration with the other agencies. We identified also contact points, similar as EFSA had for a number of the projects, for Matrix, for Harmony, Orion, and Cohesive, at least. And there were even plans, I know, that project participants would come and stay with ECDC for a while, but I know at least in one or two cases that was then cancelled because of the pandemic and the lockdowns. So I think the whole interaction was colored a little bit by the fact that ECDC was completely absorbed in the pandemic, and also the constraints it put on US project participants. But for the priorities of ECDC as such, I mean, they are partly given by the Commission, and partly we are consulting the ECDC Advisory Forum, which is composed by with representatives of each member state, and they are commenting on the ECDC work program, and thereby we are getting input from the member states on the annual work program. Thank you.
Yeah, thank you very much. Also, thank you for introducing the fact that these priorities then changed in time. So we started back in 2018, but then things changed. We also noticed that the One Health arena was changing. For example, there was more interest in the environmental side of One Health. We have seen more. We have seen, I would say, more or less a broader scope of One Health, as seen, for example, by the One Health high-level expert panel and their definition of One Health, which is not really sticking to the three traditional pillars. May I ask how the interest of EFSA, and then we'll move to ECDC, how did it change in time? And also, from the point of view of EFSA, how did EFSA see the One Health approach, and how EFSA sees the One Health approach now? What has changed?
Yeah, I often argue, and nobody yet convinced me of the reverse, that actually EFSA is a One Health organization, because it's in our mission statement to think of the animal health, the public health, the plant health, and the environment. Obviously, having it in the mission statement is a very important start, but it doesn't mean that you practice it in all the details that you would want to. It requires resources. My colleague Ole already mentioned the COVID, which was a very, very, very impactful, obviously, on ECDC. A bit less so on EFSA. As we know, luckily, it was not food. Food wasn't a vehicle. Still, it impacted us, and also, the COVID was a very strong wake-up call for us as agencies to come together and to reach out to each other, because certainly the ones that were so much impacted, like ECDC, was for the Medicines Agency. We actually offered also practically help to them to work out, for example, on modeling, etc. And this is something that we, I think, have learned a lesson we will need to do better next time. One thing what we also did as EFSA is last year to organize, on the occasion actually of our 20th anniversary, to organize the One conference. Maybe some of you have heard about it, together with the sister agencies. So Ole was there, Dario was there, and with the EJP as well. And that was actually also very important for us to come forward as an agency together with the partners, to say that we really want to be serious about One Health. And actually that set the agenda, not only, I think, for EFSA, but also for a number of other agencies. Very tangible outcome there is that we agreed with the other agencies to establish what we call the cross-agency on One Health, task force on One Health, where in fact Ole and Dario and me are members. And we now meet regularly, also trying to define the number of priority areas to work on in One Health.
So it looks like really the COVID-19 pandemic not kickstarted everything, but at least sped up the project, the process. Ole, when it comes to the ECDC, I'm pretty sure that the COVID pandemic was the main cause of changing of priorities.
Yeah, well, it definitely had a huge influence on ECDC's priority. I mean, we basically had to leave every other task as they were and work with all our scientific staff on the COVID-19. But we had actually, as I mentioned before, up to 2020, a plan to embark on One Health. And looking back now, I would say that had we done that, we had probably been standing a little bit more alone than we do now. Because now, as we came out on the other side of the pandemic, it seems that at the same time, everybody else, also the major global organizations, as you mentioned before, are waking up to implement a One Health approach to a lot of activities. And here, together with the other agencies, I think that this is absolutely now the right time. I think one of the finest things that the agencies can do now together is actually, and I think that here your project also has a huge impact in the member states. We must demonstrate at EU level that we can work across the various sectors, the environment, the animals, the humans, in an effective way. And then afterwards, we can go to the member states and suggest to them that they should implement similar approaches. In some member states, there's a well-developed and has been for many years, as you know, One Health approach, even zoonosis centers in some countries. But we have, we have to demonstrate at the EU level that this works well, and then we can go to the member states and say, please do the same.
Okay.
Thank you.
Yes, thank you. There's often the discussion whether the best example should come first from the EU agency or from the member states. So it's good to have both points of view. But I'm going a little bit off topic. So going back to the One Health EJP, may I ask you what role did your organization, so EFSA and ECDC, play during the really implementation phases of the research and integrative projects? Because you gave us the needs that we needed to address. Then we started working, but you were also the agency were also involved in the work of the scientific projects. Could you tell us something about this? Maybe again we'll start with Stef, EFSA, and then we'll move to
the advantage of being in the room, I guess. For sure. I mean, we indicated quite a number of topics. We heard already the numbers earlier by Arnaud. Quite an impressive number of projects kicked off. Challenging for us as EFSA to follow on all of them, which is one of probably the lessons learned of One Health. It ain't cheap and it ain't quick. So that means that probably when you do One Health operationalization, you need careful planning. You need to allocate resources. We did manage to follow a number of projects a bit more intensively because they were very close to our remit. I'll say a bit more in detail tomorrow. Arjen, for example, cohesive, because they were so close. They are so close to what we are doing on One Health surveillance, for example. Very strikingly, we had actually a pilot project from Arjen with a person actually resourced by the BFR to come to spend time both in EFSA and ECDC. Already Ole mentioned it before. It was stopped, unfortunately, by the COVID. Actually, the person was in EFSA on the day that the COVID blocked all the trains and the planes and the meeting rooms, unfortunately. Still, we did continue virtually with this pilot project, which was a hands-on project to work closely on, for example, the glossary, the One Health glossary, and the crack, the One Health crack, which I'll tell a bit more on tomorrow. So basically what we did is, after indicating the number of research needs, we followed more specifically a smaller number of projects closest to lesson learned there. Indeed, when also now, for example, the European partnerships are kicking off, the new instrument on the Horizon Europe, we feel it's important to be part actually of the consortium. So for EFSA, the first time to become a partner in such projects, because it requires resource allocation from our time to be able to follow over time on the project.
Yeah, thank you. The glossary is something that comes up pretty often. Apparently, this is very much appreciated. Ole, from the point of view of ECDC, how did the ECDC follow up the project while they were implementing?
As mentioned, we had contact points nominated for several of the projects, and there were interaction between the project participants and our representatives, not only for prioritization but also participation in various meetings and commenting on things, and so there was some interaction. But as I mentioned before, I think after 2020 the scene changed completely, and I think there we had to step a little bit back and was unable to maybe live up to the expectation that would have rested on our shoulders. And as it is actually only now in the aftermath of the pandemic that we can return and try to work on the One Health again. Thank you.
Yes. Still, we kept you up to date and there were liaison officers, but of course the situation was different. Okay, thank you very much. I'd like now to go a little bit forward also in time, because we have identified those needs. Well, the stakeholders identified those needs. We started to address them, but then as time went by, we realized that the whole One Health arena was changing and we needed to keep up with it. For example, we realized that the environmental pillar of One Health, the environmental side of One Health, was finally getting the interest that it deserved. So was finally really being recognized next to the animal health and public health pillar. Therefore, we wanted to have representation from the environmental side on board of our stakeholders committee, and what better agency than the European Environment Agency. I'd like, therefore, to introduce our next panelist, Dario Piselli, who's joining us online. Dario is an expert in environment, human health and well-being at the European Environment Agency, and he works on issues regarding the interface of food systems, environmental degradation, and human health. So, welcome, Dario. Thank you for being here with us.
Thank you, Ludo. Thanks to everyone.
For us at the One Health EJP, really, the added value of having the environmental side of One Health on board was clear. May I ask you, what was the advantage for your organization, for the EA, to be on board of the stakeholders committee?
Well, as you correctly said, and as my colleagues Ole and Stef also mentioned, I think we are really in a historic phase in the further development and operationalization of One Health, a place where environmental aspects of One Health are really slowly moving, or not really, actually rapidly moving to the center of attention. And this, of course, presents an opportunity for the EA to build on its expertise to shape the agenda on environmental dimensions of One Health in terms of research, in terms of policy, in terms of implementation. And this is even more important, I guess, if you think that the One Health concept really falls under the paradigm of sustainability. So even though the EA may not always speak in the same way as the other agencies in terms of, for example, its different mandates, that's not the regulatory science mandate, but it still has a lot of expertise to bring to the One Health table. Focuses on its experience on environmental factors, but also on its expertise on drivers and broader systems. Think about, of course, the food systems in the context of One Health, as well on the assessment of integrated responses, which is pretty much what the One Health approach is about. So in this sense, of course, while there's still a long way to go to see the environment on the same level as human and animal health in One Health approaches, I think being in the stakeholder committee for us really helped us have access to those community of practice that we need to work with to achieve the objectives that I was mentioning earlier, to start to collaborate together, signal priorities better on the environmental dimension of One Health. And the other advantage is that our involvement was also, I think, very useful to develop consensus internally at the EA on the importance of building our own capacities in the area of One Health, understand where we need to reflect the One Health concept better in our own existing work. And in particular, as it was also mentioned, once again, I think it has heightened our awareness of the importance of collaborating with one voice with a colleague from the other agencies as well. The simultaneous presence on the committee of EFSA and ECDC really played a role for us, and I think it was also very helpful that we were there together, because it helped a lot, and it had an influence on the establishment of the One Health cross-agency task force, undeniably, I feel. All
right, thank you. So it looks like our stakeholders committee was a chance not just to interact with the One Health EJP, but also as a forum to interact among the agency, which is very nice to hear. I have one other question. Can you tell us how you have been involved in the stakeholders committee, given that the EA came on board just while the project was ongoing? And also, do you feel as the representative of the EA, were able to influence our work, the work of the One Health EJP?
Well, as you rightly mentioned, we came on board a bit later. So for us, a big part of the role for us was really to be present and to signal priorities on the environmental side, emphasize the importance of the environment in communication activities, in looking at findings of different One Health EJP projects that had an environmental dimension. So, of course, when I guess compared to the contribution of the colleagues from EFSA and ECDC, our involvement is younger and will continue to grow, I think, in the future in this space. I still feel that our presence has been useful to reinforce what was already quite evident to many in the One Health EJP, which is the need to pay more attention to the environmental aspects of One Health, also in terms of bringing different communities together to try to understand the implications of One Health research also for environment, and vice versa, the implication of the environment for One Health research and policy. So I think what we tried to do was to emphasize and provide visibility to this notion, to try to identify specific priorities for future work and research, both vis-a-vis the members of the One Health EJP, but also the broader community, I would say, that was impacted by the One Health EJP during the various events and dialogues that were hosted by the program. And so on the one hand, I think this influence, even if only indirectly, has led the One Health EJP members to emphasize environmental factors and the environment in some of its communications and events. It wasn't necessarily because of us. Again, it was a bit indirect, but it led to the production of a report highlighting the main findings of the various EJP projects that related to the environment. And on the other hand, I think it hopefully served to lay the groundwork for the incorporation of the environment in future initiatives in a research coordination perspective, but also as a kind of signaling priorities also in the for the Commission, for member states and so on.
Thank you very much. Right, so I would like to thank you all. And at this point, we have seen a little bit how the priority of the stakeholders were communicated, a little bit how they evolved in time. But now I'd like to give the moderation chair to Karin, and let's see how now the One Health EJP addressed those priorities.
Thank you. Then I will start with calling Arjen van der Giessen up on the stage. And Arjen, he has worked with the Integrative Strategic Research Agenda and has been the leader of Work Package 2 in the OHEJP. Welcome, have a seat. So, Arjen, now we have heard from the stakeholders how they have prioritized the needs that need cross-sector collaboration. So how were these needs met when you set the strategic research agenda?
Well, actually, indeed, the stakeholder needs have been taken into account in the process of developing and updating the strategic research agenda. In fact, we already started that process to develop the SRA in 2015, 2016, with the prioritization of research and integrative topics by experts of the consortium. And, well, this was the basis for the first provisional SRA. And then at the start of the One Health EJP in 2018, we started to update our SRA and took into account several aspects. So one of them was the outcomes of a gap analysis we performed, in which we had assessed the extent to which the first round topics had been covered by the first round projects. But we also took into account, for instance, strategic links with other EU projects and initiatives through Work Package 2, led by my colleague, Lugia de Juan. We took into account updated national integrative needs through Work Package 4, at that time led by your colleague, Anne Lindberg. But also, last but not least, we took into account stakeholder needs, especially the needs of EFSA and ECDC. And all this information was used in a new exercise to update our priority research and integrative topics, and it was done by a structured approach using multi-criteria decision analysis approach. And well, you can imagine this led to ranked lists of topics, and among the top ranked topics, many stakeholder needs indeed were also included. And all these topics were processed, elaborated in topic descriptions. And then also the topic descriptions were once more checked, evaluated with the stakeholders in the stakeholder commission to ensure that the topic descriptions did meet the stakeholder needs. And well, finally, of course, these topic descriptions were, and also the stakeholder needs were included in the call text for the second round.
Yes, it sounds like you really involved the stakeholders at different levels than in the development of the research agenda. But how then were the projects commissioned to really take to address these needs?
Clearly, many of the stakeholder needs were prioritized. So they were elaborated in the priority descriptions and included in the call text. And also in the call text, it was explicitly stated to describe in the project proposals how the stakeholder needs were met. So that was one of the requirements, one of the criteria. And that is how we ensured that the stakeholder needs were embedded in the project proposals.
Yes, and then the stakeholders were also involved directly in many of the projects, as I understand.
Indeed, also, it was already mentioned by Stef and other colleagues that stakeholders were connected with specific projects, involved even in specific projects to advise, to consult. So it was really a co-operation in the mainly also the integrative projects.
Thank you, Arjen. Then I think we continue, and I will ask one of the representatives for one of the projects, Kitty Maassen, to join us up here. And Kitty was until November 2022 employed and head of the department Animal and Vector of the Center for Zoonosis and Environmental Microbiology at the National Institute for Public Health and the Environment, or RIVM. And you were also the project leader and coordinator of the joint integrative project Cohesive. But currently, you are a senior clinical research expert at Winklow Probiotics. We are very happy that you are here, and I would give you a chance first to explain the aims of Cohesive. So can you, in a few words, tell us about the project, please?
Of course. Well, of course, first of all, it's an honor to be here, not being longer an official member of this community, but I do still feel very connected to you all. So Cohesive was one of the integrative projects, and the main aim was to stimulate and strengthen the collaboration between the human veterinary food safety fields, mainly in the area of signaling, risk assessment and response, both on the national level, but also between countries. So that was the main aim of the project. One of the things that we did was to develop a practical guide to support countries to set up a more or less institutionalized official risk analysis system But in addition, there were also a lot of the IT tools developed to support the surveillance. And I think Stef will talk about that also tomorrow, because I think also there was a lot of work accomplished.
And how did you collaborate with the stakeholders? How was the stakeholders' needs implemented into the projects?
Well, I think it has been mentioned from the different directions already in this session. One of the things was that EFSA and ECDC, from the beginning, indeed, we connected to them to determine their actual needs and see how we could address them and support them in their needs. And we had liaisons both from EFSA and from ECDC. Of course, due to COVID, there has been a period where ECDC was not that much involved, unfortunately, but EFSA has been involved very strongly throughout the project, even in some of the projects really connected, so not only with regular meetings with, for instance, me and also with ECDC, but really into the projects. And in addition, I think that was very special in our project when we first started. After 1.5 years, I think 2 years, the tripartite zoonosis guide was published. And actually, that was one of the things that we were that was, of course, at a global scale. We were doing that at a European scale, but there was initially in the thought, there was quite some overlap. So we just really discussed to make it a really practical, operational guide. But also the tripartite, at that time tripartite, FAO, WHO, OEA, came to the same conclusion that that was missing in their guide. So they also started to develop several really practical tools as well. And we connected, and so actually there was a really beneficial, mutually beneficial collaboration. So we helped them with their tools, and they helped us. They attended the meetings as well. So that was also, I think, a very nice start of a collaboration also with the world organizations.
Thank you very much, Kitty. Then I think we move on. And then I will call Annemarie Käsbohrer up on the stage. There you are. And Annemarie has been the leader of Work Package 5, Science Policy Translation. And please have a seat. So once the strategic research agenda was set, all the projects started and the interactions with the stakeholders developed. And we have now seen examples of how the priorities changed during the project. There were also some changes in the One Health area, the involvement of the environment and so on. And we also got suggestions for expanding our consortium. So can you please tell us how the EJP adapted to these changing priorities?
Well, thank you very much for inviting me and giving me the opportunity. It was already mentioned. We had involved more or less from the beginning some of the very important European stakeholders when shaping the research agenda. They were not allowed to be included beforehand due to competition reasons. But then to account for these changing priorities or additional priorities, because the other ones were still very important, we started to expand the stakeholder committee. So we invited first European agencies, and we heard already the statement from the EEA, and we included also EMA in our stakeholder committee, but also then we took into account the aspect of international aspects, because there was also a request to have the global concept to take it into account. So we also more or less invited the international stakeholders to join our stakeholder committee. And I'm happy to say, even during the COVID crisis, we managed to have regular meetings within our stakeholder committee. So we changed from on-site meetings to online meetings, but we had these regular exchanges, so we could more or less explain what we are doing, and we could also collect their feedback. So I think this was very important. Also, what we did is to invite other member states within the European Union to become involved in One Health EJP and additional institutions, because more or less we wanted to cover the animal, human, food side, but we had not from all member states all the different institutions on board. At least we tried to get them involved, and we managed to get several involved. So we broadened again our scope. So these are very important things. Stef said something very important, and this was a point of resources. So we identified it's very important to prepare condensed reports. So we identified topics and prepared thematic reports which more or less summarized what we are doing, for example, with an environmental component, or what are the needs around the COVID crisis, where are the research needs, or what are we doing around antimicrobial resistance. Though these were condensed reports, and they gave them a quick overview of what we are doing and what are possible outputs, outcomes, and what is potential impact. And it allowed them to circulate it within their institutions, but also circulate it in their networks. So more or less, one of the big activities was to support building of the huge network we have nowadays. So I think this was something how we can address it beside the strategic research agenda and all the topics and projects which were ongoing. We also made a report on the needs of stakeholders and where One Health expertise is available and could support to work on that topics. And finally, and this was mentioned already, we prepared regular reports. So we had twice a year a stakeholder committee meeting, and always before the meeting prepared a report so that they could get easily updated on what is going on, and we also could circulate it to our network and saying, well, these are the topics of interest. So more or less in that way, we encouraged all the research projects, the integrated projects, to address these topics. Another very successful instrument was dissemination workshops. Basically, they were addressed towards our national stakeholders, but for sure we also invited our European and international stakeholders. But there we combined knowledge from different research projects and integrated activities around a topic. And this, again, these were topics which had been identified of a special interest. And I think so we were able to give an answer and give some input to answer these challenging priorities.
You have already touched upon it, but what do you think was the role of the stakeholders committee during the implementation of the EJP?
Well, the stakeholder committee, I would say the role is always to get information, what is going on outside of our network, what is going on in different organizations, and also to inform them what is going on within our network. So it was more or less always an exchange in both directions to get people informed, but also we were used to disseminate information. So if any of our stakeholders wanted to disseminate something, we could more or less be the focal point to disseminate the information or the request for information, whatever the need was, to our network. So it was a direction in both ways. And we had, I think, quite a good dialogue. And hopefully we find ways to continue the dialogue, because this is something which is, very, very helpful to give support, but also to create impact on the long hand. Well, we had also some interesting input on sustainability. on advocacy. For example, we had very interesting discussions on how to shape the scientific conference we had in June in Brussels. So there was always this interaction. So I think it's an interaction, it's facilitating, sharing information among them and with us and within our network.
Indeed, this demonstrates how important the stakeholders have been for the implementation of the EJP. Thank you, Annemarie. Before we end this part of the session, I have a question for all our stakeholders present. And that is, what do you think is the most important outcome that benefited your organization? And it looks like you will start, please.
I think for the Netherlands, like I said, it was the progress we needed to build the trust between the organizations and the partnerships. And that's what we see nowadays in the Netherlands. The research projects are sometimes combined. People know each other, and I think that's the core of what EJP has brought us.
Thank you. I think more than you think that. And Stef, please.
I would say amazing mobilization of knowledge and resources. You think you made things happen, which still have a long way to go, but you've mobilized resources and exchange of experience and knowledge.
Thank you. But then we move on to our online stakeholders. So I turn to you, Ole. Thank you.
Yes, I believe, as if you see, ECDC's aim is to improve the capacity of the member states. And there's no doubt that this project have created or have put on the account of the member states a large capital of One Health competency. So the whole, you could say, preparedness for future situations, for future challenges have increased with this project. So the discipline of cross-sectoral collaboration, I think, is an important impact of the project. So, yeah, so that would mean that the cohesive actually had a huge importance from our perspective, and also the ability to do risk assessment. And I'm sure that not only the more than 40 institutions that you have included, or entities you have included in the project, but there are also all those that you collaborated with, informed, took advice from, all that at national level. And I'm sure it has made a tremendous impact for the whole One Health course. Thank you.
Ben? Okay, here it is again. Then I also want to ask you, Dario, you were not there from the beginning of the EJP, but can you see any benefits for EA as well?
So it's a bit linked to. Thank you for the question, Karin. As I said earlier, I think there was a lot of value for us in terms of developing a common platform where we're discussing and learning also about One Health and sharing information about One Health with the other agencies. That for us was really, really important, and again instrumental in the work that we did after to strengthen collaboration on One Health. More practically, I would say that the most important outcome is also this forward-looking prioritization of the environment for future One Health research and implementation efforts. I think if you put that together with the capacity building that the One Health EJP has achieved in terms of the expanding really the collaboration in the One Health community in Europe. If you put the two things together, I think we can be very optimistic about achieving a true One Health approach in the future where the environment is centrally represented and people are aware of how to do it. That's also, of course, very important for us. to clearly articulate what prioritizing the environment should mean in practice, of course. So that's also something that we take on as our responsibility vis-a-vis the research community, vis-a-vis the Commission, vis-a-vis the member states. And so we really hope that this work of kind of really uniting, first of all, building capacity across stakeholders, but also uniting them around the idea that the next big step is going to be bringing in the environment is a very tangible outcome for us. It's difficult to measure, but I think it's really tangible for the future of One Health.
Thank you. There we got a glimpse of the future as well. Thank you all for the aspects you have brought up here. And now, before we finish this session, I will hand over to Ludo again.
Yeah, right. So, before we finish this long session, we have some time for questions. So you have the possibility to ask questions from on site and I think online as well. Is it correct? All right. And we have a full house. Both we have stakeholders, members of the One Health EJP here present on site, present online. So please, who would like to start?
Thank you. Pekka Jokelainen from State and Serum Institute and also part of the One Health EJP project management team. And I would like to ask our stakeholders a question based on your experience in the stakeholder committee and collaborating with us in One Health EJP. What advice would you give to the others who are joining stakeholder committee or something similar? It's a complex, large project. How to do that? Over to you.
So who would like to? Oh, Stef? Oh, sure.
I take the occasion to thank you, Pekka, and the stakeholder work package for having treated us well as stakeholders. I gained weight over these years and hopefully grown professionally also a little. I think what I really appreciated in the project is the step for science to policy, which is not so straightforward, obviously, for research projects, which is also actually, I think, a clear priority on the Horizon Europe to make this step possible, that we don't stop our research projects by having nice deliverables, but actually they become impactful to inform policy. So that we felt very much welcomed, I would say, speaking as EFSA, but I guess also my friends. As regulatory science, we're also kind of in between the science and the policymakers. So I think that is a big achievement that you have accomplished as EJP, but also with the Work Package 5. Anne mentioned, for example, the stakeholder reports, so targeted reports with the necessary information, hopefully stimulating the impact. So advice for future ones, I mean, first of all, join the club, the community. And I think MedVetNet has been mentioned, will be an important vehicle for the future. And One Health does not know borders, so nobody should stay out of it.
Perfectly agree. Ole, Dario, any word of advice from your perspective regarding new future One Health initiatives and the relation with the stakeholders, I guess?
I can start if you don't mind, Dario. I think that, as anyone who managed a large project will know that in the beginning of a project, there's ample possibility to change the direction. And as you come closer and closer to the end, this possibility declines. And you have to deal with where you have put your resources and what you set out to do. And in this case here, I think that the project from the beginning on had this very good idea that the stakeholders should be involved. And that's an important element that I think we saw missing in previous larger EU projects, where sometimes project participants in some cases were set out to deliver things that were actually already produced more or less by some of the EU institutions. So I think it here as a stakeholder, it's a golden opportunity to make use of the quite large resources that are put into these projects, if it is done in the way that you have now done. Thank you.
Thank you. Dario, please.
Well, on my side, I can just, emphasize or build rather on something that Ole just said, which is that I think it's quite important if we look forward, for example, into Horizon Europe. We have a lot of projects that really try to have the concept of One Health at their core, whether they look at food systems, whether they look at AMR. I think from a stakeholder engagement perspective, it's so vital that these projects try to replicate what the One Health EJP has tried to do in terms of having stakeholders from different sectors involved. For example, in my case, or in the case of the EA, of course, it's about bringing in the role of the environment. But more broadly, I think it's also the idea that these different projects need to consider each other as important stakeholders to make sure that basically important stakeholders of each other to make sure that they really collaborate from the very beginning of their own projects to ensure that they reflect the One Health approach in their own work. And the other aspects maybe is the fact that I think as agencies, of course, we have a specific role vis-a-vis, of course, research coordination and Horizon Europe projects. But beyond that, I think it's very important the Science 2 policy translation. So, of course, going even beyond the agencies, making sure that also future initiatives continue to involve also the Commission, try to reach out to the member states, those where those actors where a lot of the findings would actually then be implemented. And it's not only the agencies then, but it's a lot of other policy actors as well.
For sure. Thank you. So really not to reinvent the wheel. This might seem trivial, but it's not so, to work on what is already existent. Any other? Sure.
I have a question for Kitty. And that is, I know you collaborate with stakeholders in Cohesive. And what was lessons learned from this collaboration? Do you even have some advice to future projects, how to approach stakeholders and how to interact with them?
Let's have a microphone, that helps. That's an interesting question. I think, of course, it also depends on the goal of the project, first of all. So I had an integrative project in which collaboration and also collaboration between sectors was a very important aspect. Actually, I think it was interesting that in the beginning we had quite some discussions on indeed how to best have our own goals combined with the goals that fit the stakeholders. So that was quite challenging in the beginning. But by doing that in the beginning, I think in the end we have nice products, which I hope the stakeholders can do something with. But also, and that's something I didn't mention earlier, so we have, of course, now our European organizations. I mentioned the world organizations. But I think it's also very important to mention the national ministries, and especially in the project that Cohesive was doing, trying to support countries at the national level. In the end, we have done several pilots and where the different sectors were present, but in some of them also representatives from the ministries. And I think that is very important to be able to get it implemented and to get stakeholders involved also in that very early stage when you try to achieve something. So actually it's very simple, start early.
Thank you.
Do we have any question from online? Oh, but we have a question from the audience.
Hello, I am Pieter Jan Sijsens, a scientist at Scienzano. I have a question for Dr. Piselli. I am a scientist, and so you said that the environment should be a priority. And of course, here in this room, I think the vast majority of people work for public health and veterinary labs. And de facto, we start actually from the patient, being either, I think, a human or an animal patient and his health. And I have problems thinking about the environment as a scientist, because I think most of our colleagues here do not know what that actually means. The environment is, of course, everything, and I could say that maybe it's even more a societal question than a question directly related to our daily work. So my question to you is, could you give maybe one or two examples of prioritization in the context of, let's say, public and veterinary health of environmental issues? Thank you.
Sure. Thank you for the question. And I indeed was quite vague in some of the answers, saying, the environment, just because we had limited time in terms of, in terms of what we could say in terms of prioritizing. But I think there are two dimensions to this question. One is, I would say, on the actual work that already now, let's say what we traditionally think of as, One Health approach, which is to, surveillance to public health. And I think there, one of the main examples then would be to really try to incorporate environmental factors into surveillance systems and early warning systems. And I mean, this relates, for example, to bringing in the monitoring of, just to give an example, the monitoring of antimicrobial resistance genes and antimicrobials in different environmental compartments, in addition to the monitoring of how they of antimicrobials and antimicrobial resistant genes in let's say food-producing environments and in healthcare, for example, which is of course a topic that's becoming more and more important. Also to try to really understand what are the dynamics, right, of how these genes can be and residues can be spread back into different environmental reservoirs and then maybe back into clinical settings. Another thing could be the work on climate and infectious diseases, of course, trying to look at how changes in climate are changing the suitability of different areas and distribution of vectors of disease, for example. These are when we think about more in I would say in the practice and in risk assessment, for example. But I think there's also an element that relates more to let's say to the concept of more integrated policy making, and this is, for example, this has to do, for example, with the role of environmental. The environmental sector, including environmental social science, I would say, in looking at the drivers of the environmental drivers and environmental pressures that drive the emergence of some of these threats to health, and trying to really bring that insight into the policy making and governance process to enable a more integrated decision making on these systems. Think about, going back to what we were saying on AMR, for example, trying to really look at how practices and production systems and also consumption patterns in relation to pharmaceuticals, in relation to chemicals, in relation to the food system and food preferences can drive, of course, increasing risk in AMR. So this would be more on the policymaking side, but it's still pretty much part of a holistic, I would say, One Health concept. I hope I was clear enough.
Yeah, thank you. I mean, when talking about the expanded environment, we would probably set up a whole new conference with biodiversity, ecology, and so on. There is so much there. I think we have time for another intervention.
Sorry, trying to help out. That you made a statement earlier reacting on Ole's comment whether it would be the member states versus European.
Oh, yes.
That one.
Yeah, so that's This is a discussion that we sometimes have also with the stakeholders, with the national stakeholders, with the European stakeholder. What comes first? Who has to give the good example? Whether it's the European level, and then the member states will take over, or it's the member states and then the showing to the European agency that, look, this is the virtuous example. So it's always it's sometimes a discussion we have. To be honest, I did not find a solution, so I wouldn't know. But if you have some words of advice on this, well, happy to.
I don't have any words of advice, but maybe we can ask Ole to elaborate a little bit on it. So what do you think, what can ECDC do, and what has to be done on a national level?
If you allow me, I would just make one comment more to the question that was by Dario. I think for us, one of the major bridges to build a bridge to the environmental side is prevention. When you think about prevention, then the environment comes in a very central position, and that goes through food safety, vector-borne dengue, all these things. I mean, the environment plays a crucial role. The things we do to the environment, the changes we inflict on the environment through deforestation, whatever it may be, and the climate change that we inflict, all that has an impact on infectious disease that affects public health. So I think I understand the question that when you look at the individual case for that animal or that patient who is ill here right now, it's difficult to see the environmental component. But in the bigger picture, the environment definitely belongs there and has an important role. Could you repeat the question to me again, please?
No, the thing is that.
Well, it was about the whether if it's the member states that introduces the example and or the EU that should do it.
Or the other
I think
account, yes.
At this stage, if we talk about One Health, we actually have. If we look across the member states, from what we know from country visits we have made and so on, I mean there's quite a variation across the EU in the preparedness with regard to One Health. Some countries, as I also mentioned earlier, have since almost 20 years back or more had a very integrated approach and had zoonosis centers that were dealing with outbreaks and so on. In other countries, this collaboration is still yet in its beginning and needs to be facilitated. So I think that from the member state perspective, I mean, we have both ends, but I think it is needed that at the EU level, we need to demonstrate that we can work across these sectors efficiently and advise the member states accordingly to make that happen for them as well. Thank you.
Thank you. Yvonne, from the from a member state perspective, do you feel that your good work in the Netherlands is or at least is giving the good example to the European level? So let's say the other way around, from the member states to the European level.
Yes, but that doesn't mean that there aren't any challenges anymore. Also, we have a national action plan when it comes to the environment. The ministry which is responsible is involved, but they have different interests. And when it comes to prevention, they're not really keen on working together and sharing their data. So that's still something we need to develop, and it takes time. So even though we have a lot of experience, we're not there yet.
Nobody's there yet, I think.
No. But you can have a lot of experience, but we're trying to progress even more.
Mm-hmm. Yeah.
So, yep.
Stef, would you like to add something?
I would say cross-contamination. It needs to go both ways. So whoever has good experience, better share it. I think we're in the boat together as well, because much of what we do is regulated in law, so both at EU level but also at member state level. One very well-known barrier to obstacle to One Health, which is described also in the theory of change by the high-level group, is barriers in regulatory frameworks. In fact, we have a lot of legislation in place that prevents us also from sharing the data. There's data ownership issues. So obviously we need to respect those. We need to work within the law, but we have common obstacles to overcome. So definitely I would say two-way.
Sure, yeah. I think we have one more questions, yes? And then...
Hello, Ludo. Thank you for giving me the microphone. I just want to introduce myself. My name's Jenny Cantley, and I'm on the One Health EJP communications team. And the reason I want to speak to you is I want to draw attention to our website, because this has undergone major redevelopment and redesign this year. And you will be able to find all the latest information on the joint integrative projects and the joint research projects and the PhD projects. So we're talking 30 projects, 17 PhD projects, which is quite a large number. And if you go onto the project pages, so if you go to the home page and look for the projects, project leaders have actually recently this year updated the project pages so that it shows their key outputs, outcomes, and impact, and link to the stakeholders. So how these projects have actually benefited the stakeholders, and they've given specific examples. So I would just like everybody to have a look. Thank you.
Right, so I think this was the perfect way to close the session. Go on the website and take a look at the project. There's also a very functional search function in which you can search for keyword. Any last remarks from the panel? From the online? Okay, then I think, yeah, we're perfectly on time. I thank you very much for your attention. And I think we have a break now. We see each other. Thank you.
Thank you very much.